Maternal mental health encompasses the psychological well-being of women during pregnancy and the postpartum period. This critical phase involves a range of emotional and psychological challenges that can significantly impact both the mother and the child. Two of the most common conditions affecting maternal mental health are postpartum depression, PPD, and postpartum anxiety, PPA. Understanding postpartum depression. Symptoms and prevalence. Emotional. Persistent sadness, crying, feeling overwhelmed. Behavioral. Withdrawal from family and friends, loss of interest in activities. Physical. Changes in appetite and sleep patterns, fatigue. Cognitive. Difficulty concentrating, feelings of guilt or worthlessness, thoughts of self-harm or harming the baby. PPD affects approximately 10–20% of new mothers and can begin any time within the first year postpartum. Risk factors. Biological. Hormonal changes, history of depression or other mental health disorders. Psychological. Low self-esteem, negative birth experience. Social. Lack of support, relationship difficulties, financial stress. Understanding postpartum anxiety. Symptoms and prevalence. Emotional. Excessive worry, feelings of dread. Behavioral. Restlessness, irritability, avoiding certain activities or places. Physical. Heart palpitations, dizziness, muscle tension. Cognitive. Intrusive thoughts, constant fear about the baby's health and safety. PPA is less well studied than PPD but is estimated to affect up to 10% of postpartum women. It can occur independently or alongside PPD. Risk factors. Similar to those of PPD, with additional emphasis on personal or family history of anxiety disorders. Impact on mothers and families. Mothers. Decreased quality of life. Impaired ability to care for the baby. Increased risk of chronic mental health issues if untreated. Babies. Potential developmental delays. Emotional and behavioral issues later in life. Disrupted bonding and attachment with the mother. Families. Strained relationships. Increased stress and conflict. Financial and logistical challenges due to the mother's reduced ability to function. Treatment and support strategies. Screening and diagnosis. Routine screening during and after pregnancy using standardized tools. For example, Edinburgh Postnatal Depression Scale. Early identification through healthcare providers, including obstetricians, midwives, and pediatricians. Therapeutic interventions. Psychotherapy. Cognitive behavioral therapy, interpersonal therapy. Medication. Antidepressants, anxiolytics, considering the safety for breastfeeding mothers. Support groups, peer support, community groups, online forums. Self-care and lifestyle modifications. Regular physical activity. Healthy diet. Adequate sleep and rest. Mindfulness and stress reduction techniques, yoga, meditation. Social support. Partner and family involvement in caregiving. Practical support, for example, help with household chores. Emotional support from friends and family. Public health and policy. Raising awareness about maternal mental health. Integrating mental health services into prenatal and postnatal care. Providing resources and training for healthcare providers. Ensuring access to affordable mental health care. Conclusion. Addressing maternal mental health challenges is crucial for the well-being of mothers, their babies, and their families. Early identification, appropriate treatment, and robust support systems can mitigate the adverse effects of postpartum depression and anxiety. Prioritizing maternal mental health, society can promote healthier outcomes for both mothers and their children. Thanks for watching this video.